Okay, so for the marketing, we will use an old technique, which is word of mouth. We want to target all Chinese population, but we will start with the elderly, and then we will start using social media, targeting their kids, because most of the in China society, children take care of their parents, and we will target the social media for that. And then we also will work with the residential committee. Residential committee is the leader in their residential area, and basically they're the one that decide what happened in that area. So we want to have them as the influencer. And then we also have the partnership with a local hospital. We can help them building the data infrastructure, and it's also in line with the initiative, China Healthy 2020 initiative, the new initiative by the president. So this will be our marketing channel. And then next, it will be our risk and opportunity analysis. So we will partner with the local hospital, Red Cross, and volunteer. The volunteer can be the medical student, because they also need volunteer time to finish their study. And then the risk is their policy changing, and if the program failed, then we will losing our initial investment, but it will unlikely to happen. And then our opportunity here, as we see in the video before, how unfriendly and disorganized right now the healthcare system in the state level hospital. And also our other opportunity is that it is in line with the program Healthy China 2020, which is Chinese government want to make China healthier, and they will also focus on the preventive care. Okay, so for the next slide, I will go to my friend here, John, to give the information.
Hi everybody. So I'm going to talk a little bit about our financial model. We have this next slide here. We have our fixed cost, our operating cost, and our total cost per patient. One thing you're going to want to take away from this is the fixed cost is important, but the real number that's important is the variable cost, which we have listed in our appendix as well, because those are the costs that are going to change. And our enterprise is based, as I'll explain a little bit more in the milestone slide coming up, is based largely on our partnerships that we will form with the local hospitals. So we project, as you can see here, and I'll get into it a little bit more, but after about the 3-month mark, we plan on partnering with one hospital. Now, after the 15-month milestone mark, the financials are going to change. So the partnerships with hospitals will allow them to, will allow us rather to lower our costs. How? It will allow us access to personnel that the local hospitals will provide. It'll allow us access to medical equipment, medical expertise that the local hospitals will provide. All these things lower our, lower our costs from about $3 total per customer to about 70%. 70 cents on the dollar per customer. So if you look here, our initial ask. So what we're asking for is an initial investment of $25,000. What this will get are, like I said, partnerships. It'll get us into a large servicing area. Once we hit our first milestone at the 3-month mark, we aim to be partnered with one hospital, servicing one community, and covering a population size of about 4,000 citizens. At that point, we will ask again for another investment of about $100,000. Following that to our next milestone, at the 9-month mark, we aim to be partnered with 5 local hospitals. The service area will be one whole district, and the covered population will be 150,000 citizens. At that point, we are asking for another investment of $1 million, and taking it to our next milestone at the 15-month mark, we will be partnered with 10 hospitals serving the greater Shanghai metropolitan area with a covered population of approximately 1.5 million individuals. Why will the local hospitals support us in this venture? Well, the local hospitals are hurting for funds, which does not allow them to service the population as they should. In addition, the data that we will collect from each customer we service will allow local hospitals to build out their data infrastructure and help them in many other ways. And with that,
So that really concludes our presentation, and I'm gonna pick up the stick. And you guys can ask me a question, and I don't need a mic because my voice is loud enough, I guess.
Okay.
Any question?
You want to record it? The Q&A?
Yeah, Q&A.
You want to record it?
Yeah.
Just...
No, it's fine.
Okay, good.
Question?
Question? Sorry.
Yes.
Okay, you have question for Lee?
Yeah, I think this is really good. It's a really good initiative, but the country of choice, I think, is very challenging, and some of the numbers didn't really add up. Maybe I was not really following, but from Penny's presentation, she said that the capacity, you can cover a capacity of about 4,200 persons per month, and then on this slide right here, you have within 3 months you are covering samples of 4,000 persons. So I don't know exactly how you reconcile that.
Great question.
Great question.
That we goes to the appendix.
Okay.
All right, so I'm gonna ask this Q&A. So here's a key assumption. We don't know. There's no accurate number, and we are assuming. So those are the key assumptions. The first thing we're gonna do is we're gonna buy one van, which is gonna cost us $5,000, and each van we're gonna have about 4 volunteers, right? So 3 medical school students, and then probably 1 doctor or with professional license, so they can monitor us to do the checkups driving into the local community. So assuming one van take four workers working per day, we have 5 minutes checkup, doing blood pressure, collecting the sample data, and assuming taking out all their bathroom break, lunch break, and the slacking off hours, they have 4 effective hours per day, assuming taking out all the inefficient times. That equals 200 patients per day. Now, different months have different days. Some months have 31 days, some months have 30 days. With that said, some months have 22 effective working days, some months have 24 effective working days, some has 20 effective working days. So we're using conservative measure. 200 times 20 equals 4,000. 200 times 21 equals 4,200. So that's why there is a discrepancy, but it's really around that measure. So we are using conservative measure to find out how many people are in the. By the way, you guys can interrupt anytime, and you don't need to listen to. I speak a lot, but those are the conservative measure in terms of finding how many patients. In terms of the cost structure, remember he said about 31 cents.
Let me just interrupt quickly. Are you calculating patient, or are you looking for number of checkups made?
So here's what I want to show you. Oops. I don't know why I had it open.
The appendix?
Yeah. Did you close it?
No, I didn't close it.
So yeah, it takes a little time now.
No, but you can go to the easy pen, right? It's there.
What do you mean?
In the easy pen's presentation on the last page, there's the appendix there. The appendix.
Yeah, but I wasn't trying to show the appendix though. I mean, it's fine. So what's the?
My question was: are you targeting are you measuring? Your unit of measurement, is it number of
right
checkups per day or number of patients? Because if you talk about number of patients, how do you ensure that you're not going to be repeating someone within a community?
That's a great question. So this is why I'm showing this actually. So what happens? This is a typical Chinese sort of community district, right? How I know that? Because I was born here, right? Actually, I was born in this apartment, actually. And this is how it looks like here. This is how it looks like, right? This is a business.